State of Michigan signed an act into law at the start of 2015 that's impacting patients and the protocol involving their mammograms.
The law went into effect this past June. It requires doctors to inform women if their mammograms show dense breast tissue. In this month's Your Health Matters, 7 and 4's Melissa Smith explains the potential impact.
I was happy to see the card in the mail and say, you know, talk to your physician. There's other options, things that you can do.
Pam Maswitz is talking about the new state law that's creating some buzz when it comes to patients and mammograms. The law requires patients be alerted if dense breast tissue is detected during their yearly mammogram.
I had a great aunt that had breast cancer. I was not quite 40, but 38. And we did my baseline, and I knew at that point that my breast tissue was a little more dense.
Pam not only has dense breast tissue, but is also a radiology technologist at Munson Medical Center in Traverse City. She sees these types of situations on a daily basis. Once she found out she herself has dense breast tissue, she received this pink notification in the mail. The card is sent out to patients once their mammogram detects any dense tissue.
The legislation requires us to notify women of if they have dense breast tissue. It doesn't require us to do anything more than what we used to do as far as interpretation of the images. We've always included the breast density, but we now have to notify the individual.
Charles Weitz is the director of breast imaging for Munson Medical Center. Dr. Weitz says almost half of the population of women in the U.S. have dense breast tissue.
This is a normal finding. The thing that the legislation is trying to address is that the denser the breast tissue, the sensitivity of the mammogram diminishes. And so sometimes the dense breast tissue can mask or hide a breast cancer.
Dr. Weitz says giving the patients information both in writing and verbally is a way to educate them on further tests. However, he thinks there are pros and cons to the new law.
The upside is to empower women to be able to know that their breast tissue is dense and that the mammogram may be less sensitive, and to offer ancillary or additional studies, that imaging studies that could be utilized in conjunction with, not replacing the screening mammogram, but used with it, such as whole breast ultrasound on an annual basis, or in high-risk women using MRI. The downside is the more tests we do, the more false alarms there are going to be, more things that we might see that maybe we need to biopsy that aren't going to turn out to be cancer, or that we need to follow up in a shorter term.
For Pam Maswitz, she says it's a way to stay proactive with her health.
We research things all the time. You know, you go out to buy a car, you know what you want in the car, but so many times people don't really research their own health or other things that can be done. By having that knowledge, you know what questions to ask the doctor, and they're able to direct you to the right tests next.
In Traverse City, Melissa Smith, 7 and 4 News.
The doctor says mammograms are still effective tools to detect any breast abnormalities. The new law gives patients the opportunity for more tests if they have dense breast tissue.
The American Cancer Society recommends patients go for a yearly mammogram starting at the age of 40. Anything before 40 would be for someone with a family history of breast cancer or a genetic mutation. A reminder, you can catch all of this and all of our Your Health Matters segments by clicking on the Health tab on our website, upnorthlive.com.